Hi, I'm Scott Alexander, and if looking and feeling better is important to you, pay close attention, especially if you suffer from headaches, jaw aches, and maybe even sleepless nights. I want to introduce you to a uniquely qualified dentist, Dr. Stephen Crandall. You talked to me about a whole mouth approach and took me through each step. I had never seen this process, didn't even know it was available to me. How do you do that?
Well, we take a lot of time up front with the patients, gathering the information that we'll need to really evaluate their situation properly. We'll get the models, the photos, x-rays that we'll need, and then we'll take some time with that patient and educate them about their mouths, let them select some options that will help them fulfill the needs that are important to them.
The difference between my previous dental experience and my experience with Dr. Crandall is the amount of time that Dr. Crandall invests in each of their patients personally.
And in that time, you get a slideshow, you get a model of your mouth. It's kind of a fun process, but it's amazing how much time you spent with me and then laid out my options for doing it right today so that I would have a healthy mouth the rest of my life.
Right, and that's important for, again, the patient to understand that. And the other thing that's important for them to know is they don't necessarily have to do everything right away tomorrow, but as long as they develop this plan and do it over some time, and when it's all said and done, it'll be done properly. They won't have teeth that are fixed one at a time here and there and propagate the same problems that they came in with.
So it is a whole different approach.
Right, the way that we do it will save you from losing teeth and getting into extensive bridge work or implant work. If you take the time to restore a tooth properly right off the bat, the money you can save over time is incredible.
One of the most important things that Dr. Crandall did for me, though, was I treated for over 30 years for migraines. And I did not come in here asking for any help with headaches. And that was one of the questions I remember Dr. Crandall asked me right up front: do I experience headaches? And over the next couple of months, he worked with my bite, adjusting my bite, and doing a lot of work to even out my bite. I don't grind anymore. My last migraine was 2 months after I began treating with Dr. Crandall, and I can say I have been headache-free since he has started working on my mouth.
You do it right the first time, and you have the education to do that. Talk about how much time you have spent to benefit your patients.
Well, I've been fortunate that I've been able to go to training 3 different places in the country, one for getting the bite correct, another for placing my own implants, and getting the cosmetics right. And not only did I spend a lot of time in the past, but I continue to spend a lot of time on those areas to help the patients to get things done really well.
So to look better, feel better, and save your teeth for a lifetime, call Dr. Stephen Crandall today.